It happens on almost every dive boat. A customer hands you their medical questionnaire and they've checked yes for prescription isotretinoin, known as Roaccutane. Banning them outright costs your shop a client and usually isn't medically necessary. But treating them like a baseline diver without further screening introduces significant liability. The UK prescribing information for Roaccutane explicitly warns of decreased night vision and musculoskeletal problems. As an instructor, you are matching the diver's specific physiological vulnerabilities to the exact conditions of the day's dive plan. Moving past a binary yes or no clearance toward an objective situational risk assessment protects both the diver and the business. This chart provides an objective risk framework. A safe zone pairs asymptomatic divers with simple conditions. The danger zone emerges when complex environments intersect with medication side effects, creating liability. The yellow zones require actively curating the environment to bypass these potential risks. To determine where a diver lands on this chart, we look at 4 specific physiological factors: vision, muscles, eyes, and skin. Understanding these specific factors helps categorize which dives align with the diver's current physical capabilities and which introduce excessive risk. The first and most critical factor is isotretinoin-induced night vision reduction, which can sometimes have a sudden onset. If this occurs in the water, a diver may lose the ability to read gauges, see hand signals, or navigate in low light. You can reasonably clear these divers for midday dives in clear water. However, they should be restricted from night dives, deep dives, and any wreck or cave penetration. This restriction is non-negotiable for specialty instructors dealing with overhead or dark environments where sight is the primary safety tether. Any recent deterioration in night vision reported by the diver means diving must be completely postponed until they are medically assessed. Because vision loss can happen suddenly, low-light dives strip away the diver's safety margin, making environment selection your ultimate safeguard. The second factor involves drug-induced muscle aches, joint pain, and elevated enzymes from physical activity. Practically, the diver may fatigue rapidly, struggle with heavy gear, or lack the leg strength to fin effectively. While they may breast physical liabilities at the surface, you must be prepared to assist them with climbing boat ladders, fighting heavy currents, or executing emergency ascents. Significant joint pain restricts the diver's ability to perform self-rescue, meaning the dive professional must assume that physical burden. The third factor is severe dry eyes and contact lens intolerance caused by the medication. A diver with these symptoms cannot rely on standard contact lenses underwater and should use a prescription dive mask instead. The final factor is skin fragility and dryness, which increases susceptibility to friction trauma. Standard tight rental gear can be problematic. Ensure an optimal, frictionless fit for mask seals, hoods, and wetsuits. Adjusting the equipment setup before the dive prevents physical trauma and distractions that can escalate into safety hazards. Isotretinoin is usually compatible with recreational diving, provided you actively curate the environment. This on-deck clearance pathway helps remove the guesswork. First, confirm the underlying condition is stable with no neurological dizziness. If not, postpone. Second, verify night vision is normal. Finally, ensure muscle and joint symptoms do not interfere with equipment handling. A diver who passes these checks is cleared for standard, daytime recreational diving in good visibility. Any diver attempting technically demanding or low-light dives while suffering from vision or severe joint issues should be grounded. This protocol protects the diver from conditions their body cannot currently handle while providing a consistent standard for the shop. Divers often assume they must wait a set number of weeks after finishing their prescription before they can get back in the water. There is no medically established specific waiting period required after a client stops taking Roaccutane. Clearance is based on the physical resolution of adverse effects, particularly any visual or night vision problems, rather than a date on a calendar. Classify the drug as usually compatible, but continue to scrutinize vision and musculoskeletal symptoms during your assessment. Reliable dive operations maintain safety by aligning a diver's current physical state with the uncompromising conditions of the water.